Our next episode or chapter is on fear elimination therapy, and that was the brainchild of my hypnotherapy teacher, Robert Shields, of the Robert Shields College in England. I'm going to read bits and pieces from my book, from Breakout Now. After all, this is the web series version of it, and then I may elaborate a bit. FET, or fear elimination technique, should not be confused with EFT or EMDR, eye movement desensitization and reprogramming, which are similar but more complicated. Fear elimination technique, or FET, was developed completely independently by Robert Shields, principal of the Robert Shields College of Hypnotherapy, England, as previously stated, who was unaware of EMDR at the time that he developed FET. The technique is highly effective when the root cause or original incident of the problem is known to the client, and partially effective when the root cause is not known. If the original incident cannot be recalled, then the patient is asked to try to remember the earliest time in their life when they felt the particular unwanted feeling or feelings, which will often result in their memory being jogged to remember the event. And I'm going to generally speak on the techniques because I'm not at liberty to teach this. I'm obviously at liberty to proceed with the technique, to do it for my clients and patients, but I'm not at liberty to reveal it. For that, you must go through his course and get the hypnotherapy certification from him, the clinical hypnotherapy certification, and then you're entitled to go for the FET certification. Generally speaking, and I'm reading again from my book, it is based on two factors: neuro-linguistic programming eye scan patterns, and two, established memory patterns. And I'm going to deviate from here. I'm going to elaborate, if you will, from there. As I just read from my book, it is not crucial that the patient knows the root cause of their phobia or their fear. If you're a hypnotherapist with any degree of experience, you can regress your patient back to the time, either using timeline therapy and regressing them back to age 20, then 10, then 5, and so forth, or just use whatever techniques at your disposal to bring them to that point of realization when they had the trauma for the first time. I've never encountered a client that could not remember the root cause of their fear of bridges, or their fear of dogs, or their fear of cats, etc. They remember the very first time that dog growled at them, or the very first time the cat scratched them, etc. So that should really not be a problem for you. As well, I'm going to briefly describe, without giving away the techniques, and put forth my own experiences. When I start with a client, and it usually takes about an hour, maybe a little bit over an hour. Robert Shields states it takes about 15 minutes, but you have to get the person to recall the incident, and they have to follow your finger in certain directions that you predetermine based on when they're telling the story for the first time, where they're accessing the memory, whether it's to the left or to the right, or whether they're looking just straight right or straight left or down right. You have to determine that right away, and then you're able to move your finger in whatever direction his direction states. It also is important to determine whether they're a lefty, whether they write with their left hand or their right hand. That determines the direction you move your finger in as well. And I tell you, this is the closest thing to a miracle, to healing a trauma that I've come across, in that every time the person, my patient or client or student, relates the story, and they're all emotional, and you can see they're verklempt. And then, by the time of the last telling, you could see less and less. They're emotionally gripped. And in the end, the very last telling of the story, that's how you know when the trauma is lifted, it's just purely black and white. It's just a pure black and white telling of the story, and it's not because they've told it to you over and over. You see segmentally, and little by little, if you will, that they're less and less emotionally gripped in the event. And sometimes at the very end, they'll just giggle or they'll laugh. Um, and that really shows you right then and there, and gives you such a feeling of pride and that you've done something good for the client. So very briefly, in a nutshell, that's fear elimination therapy. I highly recommend it through the Robert Shields College of Hypnotherapy. And using that, you can eliminate a root cause that is stopping you or hindering you or slowing you down from achieving all that you can be.